Have you ever brushed off a persistent itch, thinking it was just dry skin? What if that constant irritation was more than a minor nuisance, and actually your body's early cry for help? For older adults, especially those over 60, could an itchy patch be the first sign of something far more serious, like cancer, before any other symptoms appear? Most people don't associate an itch with something life-threatening, but in many older adults, unexplained itching, particularly in specific areas, can be an early red flag that your body is trying to alert you to a deeper, hidden issue. While the itch may seem minor or easy to ignore, it could be a subtle clue pointing to an underlying health condition, including cancer. In today's video, we'll break down 5 specific itchy spots that are often overlooked, but may be connected to more serious internal problems. We'll share real experiences, medical context, and important visual cues to help you recognize when an itch is more than skin deep. This is not just about identifying a common discomfort. It's about understanding the difference between harmless irritation and a potential health warning that deserves attention. You'll learn how to distinguish ordinary itching from the kind that should raise concern, and what practical steps to take to protect your long-term health. These are things that most people wish they had known sooner, because early awareness can change outcomes. Knowing what these signs mean may truly make all the difference. Before we get started, if you find this video helpful, I'd really appreciate it if you could give it a thumbs up. Your support helps us continue to share important knowledge for healthy aging. And if you haven't subscribed yet, now is a great time to hit that button and turn on notifications so you never miss our future videos. Also, let me know you're here by commenting 1 below if you like this video, or 0 if you don't, so I can continue improving content for you. Let's dive in with the first sign: persistent itching on the lower legs. For older adults, an ongoing itch that affects the lower legs, especially the shins and calves, can easily be mistaken for a simple skin irritation. It's often blamed on aging, dryness, winter weather, or even a new pair of socks. At first, it seems minor, just another little discomfort we brush off and move on. But here's the catch. When that itch persists for days or even weeks without any visible rash, no dry patches, no redness, and no obvious trigger, like switching to a new lotion or laundry detergent, it's time to look closer. This kind of unexplained itch is increasingly being recognized in the medical field as a potential early symptom of something much more serious. This type of persistent lower leg itch has been increasingly recognized as an early warning sign in individuals later diagnosed with blood-related cancers, most notably lymphomas, such as Hodgkin's lymphoma. Unlike the fleeting discomfort caused by dry skin or mild irritation, this particular sensation is unrelenting. It doesn't fade with time or respond to the usual remedies. Moisturizing lotions, steroid creams, and antihistamines often have little to no effect. The itch lingers, and for many, it grows worse at night. So what makes this kind of itch so different? The answer lies deep within the body's immune system. Lymphomas begin in the lymphatic system, a critical part of your immune defense and fluid regulation. As malignant lymphocytes multiply, they begin releasing a variety of inflammatory chemicals, including cytokines, into the bloodstream. These cytokines don't just circulate passively. They irritate nerve endings under the skin in a way that triggers a profound and sometimes even burning itch. It's the kind of discomfort that feels like it's coming from beneath the skin, not on top of it. Why the lower legs? These areas contain a dense web of sensory nerve endings, and the skin there is relatively thin, making them especially vulnerable to this internal irritation. That's why, in many reported cases, the shins and calves are the first places where this type of cancer-related itching shows up. Take the case of George, a 75-year-old retiree who shared his story during a community cancer awareness seminar. For nearly 6 months, George dealt with nothing more than a persistent itch on the front of his lower legs. It never seemed serious enough to raise alarms. He thought it was part of getting older, maybe a reaction to a new soap or laundry detergent. His doctor wasn't too concerned either, and prescribed a topical steroid cream, assuming it was a case of mild eczema. But nothing helped. The itch grew stronger, especially at night, interfering with his sleep and slowly wearing him down. It wasn't until a routine blood test revealed elevated white blood cell counts, and a follow-up scan showed enlarged lymph nodes in his chest, that George received a diagnosis of Hodgkin's lymphoma. Looking back, George realized that the itch had been his body's earliest, and for several months only, warning sign. That pattern is more common than many people realize. While it's important not to panic over every unexplained itch, the defining difference in these cancer-related cases is the persistence and resistance to treatment. Unlike typical skin conditions caused by dryness, allergies, or minor irritants, this itch doesn't come with visible symptoms. There's usually no redness, no rash, no peeling skin, just an overwhelming, unexplained need to scratch that nothing seems to relieve. And for older adults, whose skin is already more sensitive and whose immune systems may react differently with age, paying attention to these kinds of subtle, lingering signs can be especially critical. As we age, the body doesn't always express distress in the same clear ways it might have in younger years. This subtlety is important to understand. Aging can dull or mask traditional symptoms, making it harder to recognize when something's wrong. Pain might not be present at all. Lumps, if they exist, may be too deep beneath the surface to detect by touch. But while these signals may be quiet, the nerves remain active, and a persistent, unexplained itch can sometimes serve as the body's early whisper that something deeper is going on. That's why paying attention to patterns matters. If a chronic itch is accompanied by other vague symptoms, like unexpected night sweats, unusual fatigue, unexplained weight loss, or swollen lymph nodes, it's time to take it seriously. Don't wait for symptoms to become obvious. Speak with a healthcare provider and request a full evaluation. This could include blood tests, such as a complete blood count, CBC, or imaging studies like a CT scan, depending on what the doctor finds. For older adults, the body often communicates in subtle, easily overlooked ways, and listening to those signals could quite literally save your life. Let's move to another often overlooked symptom: itching between the shoulder blades or across the upper back. For many older adults, a persistent itch in this area is quickly chalked up to something benign. Dry winter air, poor posture, or even a scratchy clothing tag might seem like the obvious explanation. And sometimes it is that simple, but not always. When the itch feels deep, almost like it's coming from within the body instead of the skin's surface, and it refuses to go away despite creams or lotions, it may signal something more serious. In particular, this type of deep, stubborn itch between the shoulder blades has been identified in some cases as an early warning sign of pancreatic cancer. Surprisingly, this discomfort can occur months before the more recognizable symptoms, like jaundice, abdominal pain, or digestive problems, begin to appear. That's what makes it so critical to recognize. It may seem puzzling at first. After all, the pancreas is located deep within the abdomen, so how could it be linked to a sensation in the upper back? The answer lies in the way a tumor in the pancreas affects the body's bile drainage system. Even small tumors can begin to block the bile ducts that carry bile from the liver to the intestines, which is essential for proper digestion. When these ducts are partially or fully obstructed, bile salts can start to build up in the bloodstream, a condition known as cholestasis. These excess bile salts don't just stay in the blood, they often make their way into the skin, and they tend to accumulate in areas that are densely packed with sensory nerve endings, such as the upper back. The result is a deep, internal itch that isn't caused by anything on the skin, but rather something happening much deeper inside. People have described it as a phantom itch, persistent, gnawing, and unrelieved by topical treatments. This kind of deep internal itching can be frustrating, especially when no treatment seems to bring relief. That was exactly the case for Linda, a 70-year-old grandmother who experienced this unsettling symptom for several months. The itch between her shoulder blades would wake her up at night, night after night. She tried everything: moisturizing creams, antihistamines, changing her laundry detergent, even replacing her mattress and bedding. Yet nothing seemed to help. The sensation persisted. What made it even more perplexing was how she described it. It didn't feel like a surface itch. Linda said, "It feels like it's coming from inside my body," as though no amount of scratching could reach it. Eventually, during a routine visit to her doctor for unrelated fatigue, blood work revealed something unexpected: elevated liver enzymes. That simple result prompted further testing. An abdominal CT scan later uncovered a small tumor in the head of her pancreas. It had been pressing against her bile duct, and that internal blockage was the hidden source of her distressing itch. At the time, Linda had no pain, no signs of jaundice, and no gastrointestinal symptoms at all. Just the itch. But because she spoke up, and her doctor listened, the cancer was detected early enough for treatment to be a viable option. This kind of itch is very different from the usual irritation people associate with dry air, friction, or seasonal skin changes. It tends to be highly specific in location, often centered right between the shoulder blades, and it stubbornly resists typical remedies. No lotion, no soap change, no antihistamine brings lasting relief. That's why this symptom deserves attention, especially for older adults who may feel hesitant to mention something that seems minor. But in cases like this, specificity matters. The location, persistence, and unresponsiveness to treatment all point to something more, and when paired with other signs, such as darker than normal urine, pale-colored stools, fatigue that doesn't improve, or unexplained weight loss, it becomes even more important to act. If you or someone you care about is experiencing a deep, nagging itch in the upper back, especially if it's located between the shoulder blades and won't go away, don't ignore it. Speak with a healthcare professional. Request liver function tests and consider imaging like an ultrasound or CT scan. These tools can help uncover internal conditions before more severe symptoms arise. The upper back may seem like an unlikely place for a message about pancreatic health, but sometimes the body speaks through unexpected channels. Listening to those signals, even when they seem small or strange, can make a life-saving difference. If you're still with me and finding these insights helpful, I'd love to know you're watching. Please comment 1 below so I can continue sharing meaningful content that matters to you. Let's continue now with another area that many older adults overlook: an itchy scalp without visible flakes or dandruff. When an itch on the scalp lingers, without any visible signs like dandruff, redness, or flaking, it may seem like a minor annoyance. But when that itch feels more like a tingling, crawling, or burning sensation that refuses to go away, it could be a signal of something much deeper happening beneath the surface. This kind of scalp itch isn't always just about dry skin or sensitivity to hair products. In some cases, especially in adults over the age of 60, it has been linked to more serious underlying conditions, particularly blood-related cancers like leukemia, or even certain types of skin cancer that develop directly on the scalp. One of the most distinct characteristics of this itch is how stubborn it is. Unlike the usual irritation caused by dryness or a reaction to shampoo, this sensation often has a neurological quality. It's frequently described as a prickling or burning feeling that shifts across different parts of the scalp. It doesn't respond to moisturizing oils, medicated shampoos, or any typical remedies. Even after making changes to hair products or routine, the itch continues, as if it's coming from within, not just on the surface. In the context of leukemia, especially chronic lymphocytic leukemia, CLL, the cause of this itch often comes down to immune system changes. As abnormal leukemia cells begin multiplying in the blood or bone marrow, they can disrupt the body's normal balance. These cancerous cells can stimulate systemic inflammation, which triggers the release of certain chemical messengers that irritate nerve endings in the skin, leading to persistent, unexplained itching. The scalp, with its dense concentration of sensory nerves, is particularly prone to responding to this type of internal irritation. That's why it can be one of the first areas where these sensations appear. Consider the story of Henry, a 73-year-old retired teacher. For months, he noticed an unusual itch on his scalp that would strike like clockwork every afternoon. It wasn't painful, but it was relentless. At first, he blamed his shampoo or his favorite wool cap. He switched to hypoallergenic products and even stopped wearing hats altogether. Still, the itch continued. He described it as a crawling sensation, something that felt like it moved under the skin, impossible to soothe with scratching. Eventually, a routine medical checkup prompted by growing fatigue led his doctor to order a complete blood count. The test showed elevated white blood cell levels, prompting further evaluation. A bone marrow biopsy confirmed early-stage CLL. In hindsight, Henry realized that the scalp itch had been his body's very first, and for a while, only, sign that something was wrong. Beyond leukemia, a persistent itch on the scalp can also point to certain types of skin cancers, especially in older adults. Basal cell carcinoma and squamous cell carcinoma, for example, are two of the most common forms of skin cancer found in sun-exposed areas, including the scalp. This is particularly true for individuals with thinning hair or those who have spent years outdoors without consistent sun protection. In these cases, cancer may begin as a small, itchy spot, perhaps a slightly raised patch or a dry area that just won't go away. The skin might not look alarming at first, but the itch continues despite creams, ointments, or lifestyle changes. It's easy to dismiss or delay, yet it could be one of the earliest signs that the skin is undergoing abnormal changes. These changes on the scalp, whether they resemble dry skin, mild irritation, or a slightly raised patch, can be difficult to detect because the scalp isn't easy to self-examine. Unlike other parts of the body, we can't see it well in the mirror, and we may not feel the full extent of the change until it becomes more persistent or uncomfortable. That's why regular checks are so important. Whether by a caregiver, a partner, or even a hairdresser, routine inspections under proper lighting can help catch early signs that might otherwise go unnoticed. For older adults, it's especially challenging to separate ordinary changes, like dryness or sensitivity, from something more serious. The skin naturally becomes thinner and more fragile with age. But when an itch is cancer-related, it tends to behave differently. It's persistent, more intense, and doesn't improve with the usual care. No lotion or shampoo seems to help. It simply doesn't go away. So when an itch lasts for several weeks, feels different from anything you've experienced before, or comes with additional symptoms, like fatigue, frequent infections, unexplained bruising, or weight loss, it's time to take action. Speak with a healthcare provider and request a complete evaluation. That may include blood tests to check for underlying issues, and in some cases, a referral to a dermatologist. For concerns related to potential skin cancer, a dermatologist can perform a scalp exam and, if necessary, use specialized tools like dermoscopy to assess suspicious areas or perform a biopsy. The scalp is often overlooked, hidden under hair and away from view, but it can be a powerful messenger. When something feels off, don't ignore it. Sometimes, that nagging itch is your body's way of telling a deeper story, one that needs to be heard. Let's talk about another area where an unexplained itch could be far more meaningful than it seems: localized itching on the chest or breast area. In older adults, especially those in their 60s, 70s, or beyond, a persistent itch in the chest or breast region might initially feel like nothing more than a passing annoyance. Maybe it's just sweat from a hot day, or irritation from a snug shirt, or even sensitivity from a new laundry detergent. These everyday explanations seem reasonable, and often they're correct, but not always. This area of the body is one of the most overlooked when it comes to early cancer detection. Specifically, itching near the nipple, beneath the breast, or across the chest wall can, in some cases, be an early sign of inflammatory breast cancer, or other forms of breast cancer that may be developing in deeper tissue. What makes this symptom especially tricky is that it's subtle. It doesn't always come with a lump or any visible change right away, and because it doesn't hurt or seem serious, it often goes ignored. The itching is typically localized. It sticks to one spot and doesn't move around. That particular area may feel warmer than usual, irritated, or strangely tight, almost as if the skin is being stretched from within. In some cases, there may be visible differences, slight thickening, a rough or bumpy texture that feels different from the surrounding skin, or even a reddish or pinkish discoloration that doesn't go away with time. But often, there's no visible change at all, just an itch that won't quit, despite changing your clothes, switching detergents, applying creams, or adjusting your hygiene routine. And that's where the danger lies. It feels harmless, so it's easy to overlook. Consider the story of Ruth, a 69-year-old retiree who began noticing an unusual itching sensation around her right breast. At first, she didn't think much of it. Ruth assumed it was something simple. Maybe her bra's underwire was rubbing against her skin, or perhaps her detergent had caused a mild allergic reaction. She tried everything she could think of. She switched to softer, more breathable fabrics. She began using hypoallergenic soaps. She even stopped wearing a bra for several days, hoping the absence of pressure or friction would ease the discomfort. But the itch never went away. It remained in the same exact spot, day after day, sometimes even flaring up more intensely at night. It wasn't excruciating, but it was consistent, and it was beginning to wear on her. After several weeks, she casually mentioned it during a routine visit to her doctor, not expecting much. Thankfully, her doctor didn't overlook it. Upon examination, he noticed something subtle, a faint dimpling in the skin just below where Ruth had been feeling the itch. It wasn't dramatic. No obvious lump, no bruising or rash, but that small change raised concern. Further diagnostic imaging and a biopsy confirmed the presence of a small but aggressive tumor sitting just beneath the skin's surface. It wasn't the stereotypical round lump most people associate with breast cancer, and had Ruth not spoken up, it may have gone unnoticed far longer. Her case highlights something critical. Early detection can make all the difference. That persistent itch, paired with one small area of skin change, very likely saved her life. Inflammatory breast cancer, in particular, is a rare but aggressive form of the disease, and it doesn't always present the way most people expect. Unlike other breast cancers, it may not form a distinct, well-defined lump. Instead, it causes widespread changes in the breast tissue. These changes can mimic the symptoms of a skin infection or rash, making them easier to dismiss. The itching might be one of the earliest signs, often accompanied by swelling, warmth, or an unexplained heaviness in the breast. Because this cancer spreads rapidly, recognizing these early symptoms is absolutely essential. Although inflammatory breast cancer only accounts for about 1 to 5% of all breast cancer cases, its rapid progression makes it particularly dangerous when missed or misdiagnosed. That's why even the subtlest signs deserve close attention. And it's not just women who need to be cautious. For men, the warning signs are even more likely to be overlooked. Male breast cancer is rare, accounting for less than 1% of all cases, but it's real, and the risk increases with age, especially for men over 60. Many men don't think to examine their chest for changes. An itchy spot near the nipple, a patch of thickened or scaly skin, or a vague ache beneath the chest muscle might be brushed off as nothing. But these small, seemingly insignificant symptoms can be the first signs of something more serious. Men, just like women, may notice redness or dimpling on the skin, or even subtle nipple changes like inversion. These signs, though easy to ignore, should never be dismissed. Immediate evaluation is essential, and beyond breast cancer, persistent itching in the chest or breast area can also point to other serious underlying conditions that often go unnoticed. For example, swollen lymph nodes in the armpit or near the collarbone may indicate lymphoma or another form of cancer. These swollen nodes can press on surrounding tissues, causing irritation, inflammation, or a sensation that something just feels off. Sometimes the itch is paired with very subtle swelling, a vague sense of fullness, or even a dull, hard-to-describe ache in the area. What makes these symptoms so challenging is their subtlety. They're easy to dismiss, easily brushed off as nothing, especially when they come and go. But in reality, they may be early red flags. The body has many ways of signaling distress, and not all of them are loud. Sometimes it's a quiet, persistent sensation, like an itch in the same spot day after day, that tells us something deeper is happening. That's why it's crucial to pay attention to patterns. If you experience an itch in the chest or breast area that lingers for weeks, stays localized, and doesn't improve with moisturizers, antihistamines, or other common treatments, it's time to consult a healthcare provider. Don't wait for other symptoms to show up. The sooner you investigate, the better your chances of identifying something while it's still manageable. It's easy to believe that early detection always depends on high-tech scans or invasive tests. But in reality, some of the most important clues come from simply listening to your body. Your skin might not have a voice, but it communicates in its own way. And a stubborn itch in such a sensitive area is one signal you should never ignore. If you're still watching this video and finding these lessons helpful, please comment 2 below. It lets me know you're here, and it encourages me to keep sharing these important messages with you. Now let's talk about another uncomfortable, but incredibly important topic: persistent itching in the anal or genital area. Few symptoms are as distressing or as commonly dismissed as this one. For many older adults, especially those over 60, it's a topic that rarely gets talked about, whether out of embarrassment, discomfort, or the assumption that it's probably nothing. After all, it's easy to blame this kind of itch on everyday irritants. Poor hygiene, rough toilet paper, tight clothing, scented soaps, incontinence products, or even minor infections like yeast overgrowth. And in many cases, these explanations are correct. But what happens when the itching doesn't go away? When you've improved your hygiene, changed your products, worn looser clothing, tried over-the-counter treatments, and yet the itch still returns, again and again? That's when it may be something more serious. Persistent itching in this region, especially when it lasts for weeks or months and resists all typical remedies, can be an early warning sign of anal, vulvar, or penile cancer. The problem is that this symptom often seems so minor and so common that it's easy to ignore. It's deceptively simple. And because we rarely talk openly about these areas, many people endure the irritation in silence, not realizing that their body may be trying to alert them to a more serious condition. Sometimes, what seems like a harmless itch is actually something much more insidious. It may begin subtly, perhaps only noticeable after sitting for extended periods or at the end of the day. It might even seem to come and go, offering a false sense of reassurance. But gradually, the itch becomes more persistent. Over time, it can develop into a deeper, raw, or even burning sensation that feels like it's radiating from below the surface rather than from the skin itself. You might notice the skin in the area becoming rougher, more fragile, or thinner than usual. It may take on a slightly reddish, whitish, or darkened hue. Sometimes there's discoloration. Other times the skin looks completely normal, but the itch remains. And no matter how many creams, powders, or gentle care you apply, it just won't go away. Take Eugene, for example, a 76-year-old widower who spent nearly a year dealing with what he assumed was a lingering case of hemorrhoids. He tried everything: over-the-counter hemorrhoid creams, dietary adjustments to reduce irritation, sitz baths, cold compresses, you name it. But the itching persisted. It was always in the same exact spot, sometimes waking him in the middle of the night. Eventually, frustration led him to visit a colorectal specialist. The specialist performed a scope exam and found a small lesion on the wall of Eugene's anal canal. A biopsy confirmed what he never imagined: early-stage anal cancer. Thankfully, because it was caught early, treatment options were available, and his outlook was positive. Eugene's experience is a powerful reminder that when something doesn't feel right, especially if it's persistent, it's worth investigating further. For women, there's also a condition that's far too often overlooked: vulvar cancer. Though relatively rare, with about 6,000 new cases diagnosed annually in the US, it primarily affects women over the age of 60. One of its earliest and most commonly ignored symptoms is a chronic itch near the vulva. This itch often appears without any obvious lump or sore. The skin may feel unusually fragile, slightly rough, or exhibit minor discoloration. Sometimes there may be tiny sores or patches that never seem to heal completely. Sadly, many women attribute these changes to postmenopausal dryness, shifting hormones, or irritation from hygiene products or underwear. As a result, they often delay getting evaluated. But when the itching is relentless, especially if it's confined to a specific area or gets worse at night, it's a sign that should never be ignored. Similarly, penile cancer, though exceedingly rare, only about 2,000 cases are diagnosed each year in the US, can begin in a comparable fashion. An itch that doesn't go away. A patch of skin that feels just a bit different. These subtle warning signs are easy to overlook, but they can be life-saving if recognized and addressed early. Persistent itching or irritation around the penis, especially near the glands or foreskin, is often brushed off by men as a simple rash, friction, or mild infection. But when that discomfort doesn't go away, even after using creams, switching soaps, or improving hygiene, it's time to take a closer look. The genital and anal regions are packed with sensitive nerve endings, which makes them particularly responsive to subtle changes inside the body. Persistent itching in these areas isn't always just about the surface. It could be the skin's way of signaling something much deeper. In some cases, this ongoing irritation can point to more serious concerns, such as penile cancer or early signs of inflammation from other internal conditions. It could even signal swollen lymph nodes in the groin, which may be linked to lymphoma or a spread from cancer elsewhere in the body. What makes this especially concerning is that the itch might be joined by other quiet symptoms: a vague sense of pressure, slight swelling, or changes in bowel or urinary habits that feel just a little off. These signs are often so mild and intermittent that they're easy to overlook or excuse as aging or sensitivity. One of the biggest reasons people don't act sooner is hesitation. For many older adults, talking about anal or genital discomfort feels awkward, even shameful. Some fear they'll be judged, or that the doctor might dismiss their concerns. But staying silent out of embarrassment can be far more dangerous than speaking up. That itch could be your body's first, and possibly only, warning before something more serious takes root. If an itch in these areas lingers for weeks, stays in the same spot, and doesn't respond to over-the-counter treatments, it's not something to ignore. Don't wait. Schedule a visit with a trusted healthcare provider, whether it's your primary doctor, a dermatologist, or a specialist, such as a colorectal or gynecologic expert. Remember, catching serious health conditions early doesn't always require fancy tests. Often, it starts with paying close attention to subtle changes and having the courage to take them seriously. Thank you for spending your time with us as we explored the 5 specific itchy spots that may indicate something more serious, including potential early signs of cancer. Your body has its own quiet language, and sometimes a stubborn itch is more than just skin deep. It's a message that demands your attention. We hope this video has helped you feel more informed and more empowered to trust your instincts. Now, we'd love to hear from you. What's one thing you learned today that you're going to pay closer attention to? How will you apply it in your daily life? Drop your thoughts in the comments. We read them all, and they help others more than you know. If you found this video valuable, please like, share, and subscribe to the Healthy Aging Blueprint channel for more science-based, heart-centered guidance to help you age with wisdom and confidence. Wishing you good health, happiness, and peace always. And remember to subscribe to our Healthy Aging Blueprint channel. See you in the next video.